Perfect.
Okay, excellent. So my background is, in physical therapy. I also have a public health degree, and I also have a business-related degree, and I kind of marry everything to look at healthcare. And healthcare is really interesting because it's very nuanced. But just focusing on this COVID-19 pandemic, I'm going to put you guys over here to the side. I hope you can see the slides and not your faces. I don't know what.
Yeah. Do you mind presenting the presentation?
Yes. Do you see it?
Yeah.
Or,
but if you could just start the presentation so that you don't see the toolbar. Yeah.
There you go.
Perfect.
There you go. All right. So this is a very busy slide, but I wanted to just communicate the important aspect of what's happening. Guys, this is not new. Coronaviruses have been out there, and we started looking at them from the non-scientific community back in 2003 because of the SARS epidemic, right? And so it started in China, it kind of spread throughout the Americas and Europe. There was a high mortality rate. The good thing is that was contained in about 8 months. And then since that time, there haven't really been any cases. So that's very positive. However, fast forward to 2012, we see another type of coronavirus coming out here. It's called MERS, Middle Eastern Respiratory Coronavirus. And basically the transmission was from bats to camels, and then from to humans. So it even had a higher mortality rate than SARS. And the good thing is that there was less spread. So thank God that was also contained. Fast forward to now, I think everybody already knows like the timeline and the progression and when it started in December in Hubei province in Wuhan, and how it kind of just spread everywhere and has become a pandemic. And the theories around the modes of how it came to infect humans is bats to civets, which is another mammal that lives in Asia, Europe, and then to humans. So this is where we are, and this is the issue. And I think, it's good to kind of look at the problem in the nitty-gritty, right? All the different levels, like biology, and how it's transmitted, and how it impacts society, right? Because now it's the ease of spread has been so that we're now under this, shelter-in-place orders in many places. So I'm in New York, I'm in Queens, where 32% of the cases in New York are here in this borough. So any questions about this? No?
Hi, Tati. Yeah, no, this is great. Sorry, everyone was muted, but let me know if seeing if anyone's raised their hand.
Yeah.
So I think we could save maybe questions towards the end so that.
Okay, sure.
Okay, perfect. Thank you. You're doing great.
I don't want to get too into the biology, but, I just wanted to show, like, how did we get here? It wasn't really new. We've kind of had these warning signals across the time span. Oh, sorry, I don't know what happened here. Here you go. Okay. Sorry about that. So the next slide is really focusing on, and I don't know why it's not working here. Let me just end the show. Oh, can you see that slide? If not, I don't know, for some reason it's not showing it correctly, but.
Yeah, we could see it there though.
Yeah, can you see it though?
Yeah, thank you.
I wanted to talk a little bit more about how the tech community can solve lots of problems that are second order, right? So obviously, healthcare workers, doctors, nurses, allied health, they're in the front lines, they're really treating patients, but we're not qualified for that, right? So we're gonna let them handle that, but we're gonna work on all the downstream effects of what's happening currently because of everybody staying home, social distancing, sheltering in place, and basically everything has come to a halt. So what does that mean for society today? I know you're focused on these 5 particular areas, and so I wanted to kind of talk a little about each one and what solutions can be brought to each one. Homelessness. Now, that in itself is a public health issue without COVID-19, okay? And it's a societal issue. It's multifactorial. Mostly it's economic factors, but it's about housing insecurity and also a lot of public policies around the economics of housing. How can tech support homelessness in COVID-19? Well, lots of people lost their jobs. With that goes your health insurance. Even though there's some jurisdictions that have, eviction protections, that's temporary. So some people will unfortunately lose where they live. So some tech solutions would be around housing, affordable housing, food security, focusing on job opportunities, right? Maybe you lost this particular job, but you can have a part-time job and that can help you prevent from becoming 100% homeless. The next one that Carolina told me a little bit about was childhood education, right? Tech-enabled learning. So everybody's on Zoom, everybody's on all these brand new, amazing platforms, and kids may be struggling to, stay focused, learn, take notes, be interactive with, part of being in school is having peer interactions. So how do we bring that online? But it's also about access to technology, right? And I'm also looking at the intersectionality of a lot of these, because you can have kids that are homeless that are now not in school. So, how are they going to learn if they don't have, Wi-Fi, they don't have laptops? So, how can we bring that to them? I'm asking a lot of questions, and the reason why is because the questions will get you to bring groups together to solve those particular issues. And I also put here hygiene, right? Part of stopping this spread is teaching kids who are just touching everything and they have no hygiene. How do you help them learn about washing your hands and stopping the spread? Then mental health. I've worked a lot on mental health. There's so many different types of issues, from PTSD to depression, substance use. And, you lose your job and you lose your insurance. How are you going to continue to see your psychologist? How are you going to get your medication, right? So how do we make sure that there's still those resources to people despite what's happening? We use a lot of telehealth to provide one-on-one individual confidential therapy sessions. But what if people can't afford it or can't find that? Maybe you can do a group session, right? So things like that, access to care, access to medicines, and combating isolation. Then moving on to senior care. So I used to do home care, and I used to work with geriatric patients. A lot of them had neurological issues. So it's really hard as you're, aging in your home and you become more isolated, and now you really can't go out. We're also combating isolation with them, having them access to care, access to food, as Carolina mentioned, but also remote monitoring, because they're the hardest hit, right? We're looking at all the data, and they're the ones with the highest mortality rates because, they have diabetes and cardiovascular disease and so many other things, cancer. So making sure that they're safe at home and getting the things that they need, so that something, if something happens to them right now, there's no capacity. All the hospitals are full. They can't take them. And it puts them even at more risk, because then they'll be exposed in the hospital, right? So I'm going to keep going, and I'm almost done. Then the last part is medical and public health data. Carolina and I were talking a little bit about this, and this is very important because one of the ways that we could have avoided this is through better global pandemic response coordination, right? If there's a way to kind of bring together all these databases and public health information systems together, so maybe something is happening in one particular area of the world, but they may not know it's happening, but we still can get to the data. And it unlocks our ability to analyze it and get some insights as to what's going on. So data analytics, predictive modeling, very important. That's part of what we do in public health is surveillance. So the CDC prints out a lot of wonderful information about different diseases, like incidence of this and prevalence of that. And so we can better target our resources to understand where these things are happening. Where's the focus of the spread? Where's the epicenter? And it seems like New York is, for now, unfortunately, where things are happening here in the US. And one more important thing is capacity planning, right? Like if all the hospitals in New York City got together and strategically planned how many ICU beds are gonna have, how many ventilators are gonna have, how many different types of beds, pediatric beds, surgical beds, medicine beds. During something like this, we would have been definitely more efficient in responding to this. Okay, I'm gonna go to the next slide and try to be mindful of your time. So here I'm just sharing some resources from the World Health, from the CDC. My favorite is the COVID map done by Johns Hopkins. And let me see if, here it is. Can you see the map? Yeah.
Yeah.
It is, this map started back in.
Oh, actually, no. Did you pull up a, no, I just see your third slide.
Okay, let me do it one more time. There you go. Okay, can you see it now?
Yes.
Yes.
I love this map. I put it on my desktop. You see in real time what's happening across the world. We are now almost at 1 million cases, 209,000 in the US. And, you know, if you click by each region, and sometimes it's hard for the data to pull up because it's just, you know, real-time information. We have about 4,757 deaths. A lot of those could have been prevented, and that's the sad part. So definitely take a look at the resources. I'm happy to take questions even after this. You know, Carolina has my information, and I know I covered a lot in a short amount of time. I just wanted it to be targeted to what you're doing, how can tech help, and it can. And it could be tech people or non-tech people just coming together and, you know, talking through the solutions.